blessed to be able to travel like all over the world. So I've seen surgeons that do, endoscopic procedures, companies like Spineology that offer these procedures that can be done with regional pain blocks. They can be done, without general anesthesia. Many will say we've got the best disc prep technology on the market that works through that small channel. So the two most important things to me, right, is being a dad, number one, and then number two is leading people.
Matt Cronin, thanks for coming in.
Thanks for having me, Mike.
Yeah, so you're the VP of Sales for Spineology. You've been in the medical device industry for quite some time now, and I think that gives you a unique perspective, and that perspective, I think, can help educate surgeons, can help educate patients, can help educate reps, and really a lot of people in the medical device industry. So really excited to chat with you for a few minutes. So why don't you just kind of tell the folks out there who you are, what your background is, and what you're up to today.
Yeah, look, thanks again, Mike, for having me. I really appreciate it. Lovely Phoenix, right? A little bit warmer than the Midwest and certainly Minneapolis. Flying in at minus 27 degrees yesterday. So again, thanks for having me. But yeah, look, med device during a pandemic. Certainly, lots of challenges for a lot of people and patients today. But yeah, so I'm over at Spineology, and we're a minimally invasive anatomy conserving company. And what that means is we offer solutions in practice building. Think of us as more of a kind of a hub and spoke, right, or an operating system. So we help surgeons and healthcare partners practice build, provide solutions for them, and not just products, right? So I want you to think of, as we go through this, kind of a platform build for us. So
yeah, no, super excited to have you on. And full disclaimer, Optima Surgical, we are partnered with Spineology. Really believe in the technology. That's why we're partnered with you guys, and excited for where it's at and where it's going. So, tell the folks a little bit about your background. I know you and I were both at Stryker, sort of cross paths there. So how did you get into the industry, and what was your sort of career path up until this point?
Yeah, that's right. Stryker pedigree, right? So career path, I started out, I'm a military guy, right? So you grew up through the military. That's kind of a rite of passage for the Cronins, certainly myself and brothers and father. But the military, and I was an athlete too. So I competed and was a baseball pitcher, broke my arm, and ended up having surgery. So that led to surgery, and led to OR and PT and stuff like that. So I've always had this kind of affiliation and affinity towards sports, and made my way into athletic training. So I was on the field as an undergrad, and then as grad school. I went to a biomechanics, kines and sports med background, so in biomechanics. But I was on the field, and I was treating athletes, and those athletes then for Division I program ended up needing surgeries, right? So I ended up in the operating room. So I saw a lot of people like you and me in the operating room, and I was like, who are these people? Right, so med device reps, and that's kind of the influence of how I started.
Wow.
And so, yeah.
Where were you at? What college?
I was at Western State College,
okay,
out in Colorado.
Yeah.
So out there, and then on to a school in Illinois for grad school. So
nice.
That's fun.
So VP of Sales for Spineology. We were talking yesterday. You travel quite a bit. Mm-hmm. You meet a lot of different surgeons, a lot of different reps, and kind of, as I alluded to, you have a unique perspective. And so what's it been like traveling the past, year, 2 years during this pandemic? And, kind of what are your thoughts on all that?
Yeah, right. What a time, right? It's hard to believe that we've been living in this pandemic for 2.5 years. I was with a small company, German company, one of the endoscopic companies, part of the pandemic, and then with the de novo grant at Spineology, I was recruited pretty hard to come in because those two kind of marry pretty good, almost like peanut butter and jelly, right? So that first year of the pandemic, I spent on the road a lot. Last year was my second busiest travel year in my career. 228 flights on the road. So,
That's wild.
but I think it was critical, right? So I got out and met the team, and our team, and then our partners, right? And our partners meaning the distribution folks out there, healthcare providers, surgeons. So I got out and saw as many people as I possibly could, and I think it was critical, right, to understand the business and where we were, right? And so yeah, it was kind of crazy, different time, that's for sure.
Yeah, we met with a surgeon yesterday, and just really impressed with all the relationships that you've developed. You know, your endoscopic background. You know, spine surgery today, there's a lot of buzz about endoscopic spine surgery, obviously minimally invasive spine surgery. And I think, you know, you've developed a lot of relationships with those types of surgeons. And so in your mind, where's spine surgery at today? And what are some of the exciting avenues that it's heading down?
Yeah, that's a good question, right? So again, I think you look at kind of that pre-pandemic, right? And now we're in that pandemic, so I think that's changed it, or a profound change, right? So, but let's just think about Spineology as a company, or think about these less invasive procedures. From spine today, the least invasive is no surgery at all, right? So, and I've had I was blessed to be able to travel like all over the world. So I've seen surgeons that do, you know, endoscopic procedures, and some philosophical kind of differences in let's say South Korea, where it's percutaneous type procedures or acupuncture, and then you know, they look at an endoscope as surgery, right? And it is, but that's about kind of as far as they like to go ultimately. But so here we are, right? And you start to look at what's going on in healthcare in the U.S. market today, and you live it, right, every single day, and certainly it's been impacted. You think about, we talk about this great resignation, right, or we talk about how many people have been impacted just in the workforce. So you think about, you know, this overall, you know, amount of people that no longer have access or limited access to healthcare. So, you know, that's certainly changed and impacted. And then you think of the impact that it's had on staffing, right? And this continued 2.5-year kind of pandemic, which has, you know, put a lot of stress on us as well, and you and patients. But I think that's created opportunities for companies like Spineology that offer these procedures that can be done with regional pain blocks. They can be done, you know, without general anesthesia. I'm not necessarily promoting that, but it can be done that way. And we seem to do quite a bit of that today. In the ASC model, it seems like a lot of stuff is getting driven in that direction. Pairs will catch up at some point, right? But it's tough, right? So it's certainly changed, but it's afforded us an opportunity to take our OptiLift procedure and technologies and really kind of offer us a select advantage, if that makes sense.
Yeah. No, I think Spineology has a pretty unique advantage, obviously, with the OptiMesh technology. But, you know, with any company, they're, in my opinion, only as good as their technology and only as good as their people, you know? And so with your background in endoscopic spine surgery, I think matches up very nicely with what Spineology offers with their mesh technology. So I guess, you know, looking at Spineology, you mentioned a little bit about the Spineology OS, the Spineology operating system. Can you sort of, you know, walk us through the history of Spineology? You know, I know John Booth has been there as CEO for a long time, and he's an extraordinary man, and really enjoy talking with him. So can you just walk us through who Spineology is? And
yeah, it's so I've been here for about 13 months, right? So I'm kind of that new guy in leading the commercial efforts. But when you talk about Spineology, you know, it's a company that's been around for, you know, 18 plus years, founded on a mesh technology by Dr. Kuslich, and you and I have both either been around when the BAK cage was being put in, or, you know, certain revision cases as well. So Dr. Kuslich started the company. We're out of St. Paul, Minnesota. John Booth stepped in and has been the CEO for a number of years, and as you know, carrying the product and seeing and competing against us out in the field without an on-label indication. John's done a tremendous job of leading that kind of the vision and the charge of Spineology. So during the pandemic, we ended up with a de novo grant, which was pretty special, right, for us as a company. So when that happened, and all that essentially means is there's no predicate device, right? So now with that de novo grant, it allows us to coach, teach, train, right, hold courses, and talk about this product. But even more importantly, you think about what John's been able to do and take the reins, from where it started and really take it to where we're at today is pretty special.
Yeah,
but
super
now,
special. I mean,
it is.
I don't know of any CEO that's been with a spine company for 10 plus years. I think, how many years has he been CEO?
Boy, 13 plus
13
years.
plus years, yeah. That's impressive.
Yeah, it is. And you really look at, our company today. I know you mentioned and asked that question earlier, but, we have this mesh, let's call it mesh-centric technology, right? And it's think of it as, and it, right? But it's a procedure with OptiLift where you can deliver an implant or an interbody device through a soda straw, a 7 millimeter port. So that goes in and increases to the size of quite a big implant, almost an A-lift size implant. So, but that's not it, right? That's just one part of what Spineology does. So we've got that. We have think of a platform, right? So in that operating system, we have patient building, we have education, so we can help surgeons and healthcare providers build practices. So our medical education team, our sales teams have to go through a very, very rigorous credentialing process. So not only your standard programs that you and I have done over the years, they now have to step in on a cadaver and be tested, and they have to pass this rigorous test, and they get one shot. So a lot of preparation, a lot of stress, but when you have a clinician from Spineology come into your operating room, and you can count on expert service, and you know that, you see it each and every day. So from there, though, we have so many other technologies in that lumbar spine space, right? So we have things that, the OptiLift is a great indirect decompression device. We have a new lateral device too called DuoTi. So this titanium device, it's another great implant solution for surgeons today, but there's we have an indirect decompression. We have direct decompression too. We have an elite titanium expandable cage that can be delivered through a Transcam approach. So you think of the people that have either endoscopic procedures or want to do procedures that are transcamed. We have two solutions there, right? So a lot of people don't know that. And then the endoscopic piece too. We talk about that. I'm most excited there because we have a category we're working on now in the endoscopic space. So you've seen this. You've seen it front and center with a couple of surgeons, some demos that we've done. But you can seamlessly go from those folks using an endoscopic. I don't care what system it is, right? Pick the system. You can flawlessly and seamlessly move between that and our OptiLift procedure, and the workflow is, I think, pretty cool. That's exciting.
Yeah.
So that's coming out soon.
A lot of amazing stuff happening at Spineology. You mentioned patient education. Again, with your unique perspective, having traveled around the world, met with a number of leading spine surgeons. I mean, you have a lot of friends that are leading spine surgeons across the world. What would you say to a patient out there that has been told, you need spine surgery? Maybe you need a lumbar fusion. What would you say to a patient?
Yeah, that's a great question, right? And I'm not a surgeon, right? Number one, right? Or and don't try to act like one either. But I think from a technology standpoint and for a patient, right? At some point we all are, or we know somebody, right? And 80% of everyone out there at some point is going to have some sort of back issue or back pain. Hopefully it takes care of itself, right, on its own without a surgical procedure. But when surgery is needed, it's needed, right? So for those that are looking or with back pain, certainly work your way through your physicians and go through the right process. But it's a scary venture, right? No one's raising their hand to go in for any type of surgical procedure, and certainly back surgery. It's a scary thing. It's a scary venture. So. I've been, again, fortunate to be around endoscopes, less invasive type procedures, the OptiLift procedure, the Optimus procedure, and I think those things just, again, add another solution, right, for that patient today. So I think between that and any other, less invasive procedures, it's fascinating where it's come from, right? So.
Yeah, you mentioned it's pretty much standard of care in Korea and outside the United States, and it's picking up momentum here in the United States, endoscopic, spine surgery. But again, I'm not certain a lot of patients are even aware of it. And so hopefully interactions like this can help educate patients and provide them with information to help them, be a part of the decision-making process. So appreciate that. Again, looking at Spineology, you mentioned the mesh technology is extremely impressive. You have other technologies as well. In your mind, what is minimally invasive spine surgery? How do you define that? We have endoscopes, we have tubes, muscle sparing approaches. How would you define minimally invasive spine surgery?
Much the way you just did, right? So it's you go again. The least invasive is no surgery at all, but you start thinking about the way that we treat shoulders, knees. It's smaller incisions, right? It's less collateral damage going in. It's less tissue disruption, right? It's then hopefully less blood loss, which you take all those things into consideration with a patient that is either too sick for surgery, right? It's a great option for them, right? And so less invasive or minimally invasive surgery is exactly what that is. It's getting smaller and smaller incisions, and hopefully then better for patients, right? In the long run.
Yeah, I was thinking about it today. Just on LinkedIn, I saw a great video of a patient that had the OptiLift procedure and how he went through his recovery and how well he's doing. And it just got me thinking, because my background, striker, invasive, so obviously the XLIF procedure was and is very popular and is minimally invasive spine surgery. But for me, looking at OptiLift specifically, when you do it through that Transcam approach, you're not taking down the facet joint, so you're preserving that.
Yep.
You can do it through a less than 10 millimeter incision, right? So it's small, tiny incision. And then, like you mentioned, you can reduce the amount of anesthesia that a patient is under. And so to me, all those things sort of add up. And in my opinion, OptiLift, as it stands today, is at the top of the mountain in terms of what is the most minimally invasive lumbar fusion technique. And so really excited about that technology. And it's been great to work with surgeons and see how their patients have benefited. And so for surgeons out there that maybe aren't aware of Spineology and aren't aware of OptiLift, what would you say to them? Maybe they're considering it or taking a look at Spineology.
Yeah, look, it's the wonderful thing about spine today is it continues to advance and has for a number of years. So there's a lot of wonderful products but what I want them to think about, if I'm speaking to our customers, whether it's our distributor partners or healthcare partners and surgeons, is that we have solutions out there, right? So we don't look at it as products. So, but if you speak to, as you just pointed out, we can do a transcambent approach. We can do open approaches, right? So it's not just there, but we have so many different options and solutions for them today. So again, think about that patient that might be a little bit too sick, right, for general anesthesia. Well, we have an option, right, in a procedure or a solution, right, that can offer, or we can offer them a solution that they can have that selective advantage, right? They can take it to the ASC, right, or somebody can be done with some regional type block. But we have solutions that can be done for open, right? We have transcameral approaches, as I said before, with expandable titanium cages, right? We have a wonderful 1 and 2 level degen set, right? So I don't want to sound too much like I'm promoting, the products of Spineology, but I want you to think of really, again, just those solutions. Think of the scope, right? You saw it last night. We had a couple of meetings. I think 5 meetings total yesterday I had, and every one of them there's a question about the endoscope, right? So I think that for us in Spineology, a lot of people don't know that, right? That we have solutions and options with or without the endoscope, which is really cool.
Yeah.
Right. So, so for all those endoscopic people out there that, hopefully, you can do a decompression and not create some sort of an instability and may not need a fusion, but if you do, we've got something that works seamlessly with all the scopes. So we'll have that really, really soon.
Yeah,
so
that's exciting.
which is neat.
So for those surgeons out there that have maybe dabbled with Spineology, or maybe they've gone to a training and they're still on the fence, at least with mesh and OptiLift, some of the common concerns I have, or that I hear from surgeons are, disc prep. Am I going to get a good enough disc prep with OptiLift? Lordosis. Am I going to be able to restore lordosis and sagittal balance? And those are, I guess, really the two top concerns I hear from surgeons. How do you address those, or what would you say to those comments?
Yeah, those are certainly common, right? Not just for Spineology and our solutions, but for many, right? You're doing surgery through a small window. So, to look at our solutions and you look at our OptiLift procedure today, as I said, you could do a full discectomy in through a soda straw, so a 7mm port. But we have technologies that can actually help you, right, determine how well of a disc prep you have done, or how well you were doing preparing that space for the inner body. So, and you've seen it. Many will say we've got the best disc prep technology on the market that works through that small channel. So that's critical. That's critical to any procedure for surgery, right? So that's number one. And then number two, sagittal balance is important, right? We certainly hear a lot about it, right? We read a lot about it. So I guess I would ask, segmental lordosis or overall lumbar lordosis, right? So depending again on technique, there's ways that you certainly can restore lordosis, and we have options to be able to do that. But more think of Dr. Harms, right, as he kind of cheats and moves that a little bit more anterior, right? And there's techniques we do in compress and off of screws and rods and table positioning and stuff. So there's a lot of things that we can do technique wise, but I think those two things are certainly things that are not just Spineology, but those are things that have to be taken into account with any solution. So.
Yeah. And you don't have to jump right into a Transcam approach with OptiLift. I know, surgeons that I've seen at training courses, they'll do it through their traditional, open, mini open, MIS, T-lift technique where you can introduce mesh, right?
Right, absolutely. I mean, open technique, mini open, or a Transcam and perc-based procedure. So think about that. We have all those solutions, right? Again, but we're also the only percutaneous-based X-ray, right, solution out there, right? So not just one, but multiple. So that hub and spoke, right? So think of us that way. So yeah, it's fun.
So looking at sort of we hear a lot about in the past key opinion leaders, KOLs, and now there's a new buzzword, and probably have to give credit to your friend Matthew Ray Scott for coming up with this word, digital opinion leader. And so what, you mentioned a little bit about it with Spineology, helping surgeons build their brand, become digital opinion leaders. What does that process look like for a surgeon that's maybe interested in building their brand and helping build their practice? What does that process look like with Spineology?
Look, it's not much different than an individual, right? And so certainly, again, we talk about how some of these solutions in social have been, kind of accelerated through this whole pandemic, right? So, we were talking yesterday about just text and LinkedIn and TikTok and LinkedIn and Facebook and all these different platforms. But boy, it's certainly grown quite a bit. And not only we think of LinkedIn as that professional site for most, but we're all patients, right? So we're going to look at these different resources or social sites to gain more information, right? I'm going to look and find out more about Mike Budak, right, or Matthew Ray Scott you just brought up, but certainly surgeons are out there today with a big presence. So for us, we have a social kind of strategy that we do at Spineology, and we help surgeons with that as well. But it's really driving, good content out there, right, and good messaging with all the platforms. So we help with that, but certainly, it helps with things that you do, right, with your company too, and it just offers, more education, right, more access to things and content and information. So.
No, that's great. So I want to kind of take a different route here and start talking about medical device reps. You and I have both been reps, and you're the vice president of sales, so you're, responsible for the sales efforts at Spineology. So let's take a look at medical device reps and your advice for them. So you mentioned sort of the rigorous training that the rigorous training program that you've developed at Spineology, where reps come in and they have to, pass this difficult. I imagine it's on cadaver or something similar, right, where they have to walk through it. I remember when I was in invasive, and this is one thing that I loved about invasive, that at the time, because I went from Stryker to invasive, and while it was intimidating, I really loved it. It was like a 200-point inspection, and as a rep, you had to go in and do the XLIF procedure on a cadaver, which was intimidating, but I think really cool and really necessary for medical device reps. So I guess taking a step all the way back and really speaking to people looking to get into the industry, into medical sales, what message do you have for those people?
Again, we go back. Everything's changed, right? You think of, the different, if you're not in it directly or trying to break into it, medical device sales pros, right, that you've started, where people can gain access, right, and learn what it's like, right? And that's a kind of a preparatory phase, right, to break in. It's a grind, right? It's a there's no doubt about it. The amount of things that happen behind the curtains over our years, right? We've talked yesterday about, EBI, started there cutting my teeth, the different stops that we've had at Stryker. You think of your days at Nuvasive, right? In that test, right, that we think about, and just, that preparation is critical, right? My saying over at Spineology, right? We're not making sandwiches here, folks, right? So, and it's true.
Yeah.
But you think about, even our credentialing program that we started, was much like what you had just mentioned, but they have to come in and pass a very, very rigorous test. So all the things leading up to that, the terminology, right, all the anatomy, all of that detail, right, is going to be critical. And, the cool thing, though, today is, everything's so much, there's so many platforms that are, out on digital. So part of our kind of operating system that we've talked about, Spineology, we have these LMS learning modules that they go on. So there's a lot of stuff that they do before. So just getting selected, number one, get to that point, you come in, and then we train you up to that level of competence into the OR. We utilize VR glasses today, right? So we do a lot of training that way. We can do remote. I'm excited to talk about, we're the first med device company, I believe, in the U.S. that's going to be using these new synthetic models from real spine. So those would be really cool. Yeah. So we'll be able to do a lot of training in office, and it's near lifelike. Yeah. We can do that stuff remote too, but it's an exciting time, right? But to get into that is it's quite a challenge.
Yeah. Yeah. I've said this to some, a few people. Because there's medical sales college, which is a great avenue for reps looking to get into medical device sales. When I started at Stryker, there was nothing like that. So kudos to them. I know Matthew Ray Scott has the medical sales RX program, which I think you've had some people run through that, and that's a great program. I've created this medical device sales pros course along with some physicians, and what I tell people is, there is no one-stop shop where you're going to go and say, hey, I'm going to take this course and I'm going to get into medical sales, and right off the bat I'm going to start making six-figure. Right. That's just not the reality. You know, it's a whole new world, a whole new language. to go interact with a neurosurgeon, orthopedic spine surgeon. And it takes time to develop that trust with those surgeons, right? I mean, these guys and gals have gone to school for 12, 13, 14, 15, 16 years to be specialists and operate on somebody's spine. And a rep has to understand what those surgeons are trying to achieve. And you're not going to, unfortunately, it takes time to get to that point. And so I think that's something that's important for people to know looking to get into sales is it's not a quick, a quick road. It's you have to really enjoy it because it's gonna be difficult, and if you don't enjoy it and if you aren't finding ways to be better, it's just gonna be a challenging road. And so
a lot of sacrifice, right? Over the years, you think back, and you reflect on it. Rewarding, gratifying that we're welcomed or invited right into that space. But
I was talking to a person on my team last night, and she was just talking about how much she enjoys what she does, and she's got to the point where, her confidence is at a level where she goes into a procedure and she knows she's going to be able to really walk a surgeon through a procedure and answer any questions he or she has. And for her, that's just a cool feeling. And that's one thing I really enjoy about medical sales. And no matter what line of work you're in, you have to really enjoy what you do, right? And so for me, being in the OR, you get that adrenaline rush, the challenge of interacting with surgeons. So I just... Maybe foundationally, I know I'm going off on tangents here, but for you, foundationally, what sort of characteristics do you look for in a person that's interviewing with either you or one of your people on your sales team?
Boy, it's such a question, right? Because everything is different, and you even think just depending on geography, around the U.S., it's so different. Hospital systems are different, My teams are different, So, what is that? How do they fit, What's that cultural fit? There's different techniques and things that we'll use for kind of profiling into those specific roles and jobs. But in the end, it's really, past success really is an indicator of future performance, in success. So you look at that, and in a lot of interviewing, and also in those specific geographies, I try to get people that are going to join that team to interview with that team too, to see what that fit's going to be. Because in the end, even with all that, and it's still, you just don't know, Because like I said, it's a grind. You're asking, hopefully you have a novel disruptive technology, right? And those are like some of the things that we have at Spineology. So you have solutions, but boy, if you're in a grind selling a commodity product today, where there's hundreds and hundreds of let's say pedicle screws, that's a tough gig, so how are you ultimately going to get a surgeon to change, when what they're doing and providing their patients is a great clinical option with a great outcome? So hopefully, you can match all of those things together with a great solution, and you prepare them for success. And I think with all of that, it increases your probability of success. But you still don't know. I mean, we've talked about this. We came through Gallup profiling and everything else, and even with all of that, it's it's still tough, right? We're still here.
Yeah.
About that. So
I still remember where I was when I took the Gallup. So I graduated college at University of Louisville, moved to Las Vegas, and actually started with Pfizer doing pharmaceutical sales. And nothing against Pfizer, but it just wasn't for me. But one of the guys at Pfizer moved on to Stryker, and so that's how I sort of got into the interview process. But I remember I pulled off to the side of the road in Las Vegas, and I'm sitting there on the phone taking the Gallup poll, and just funny the things you remember.
Yeah. How'd you feel after that, It's
I felt pretty good. It actually, I was excited about it just because of the questions, and it was just, Yeah, I felt good about it. So
it was. I've taken many of them, right, in my stops at Stryker, and also went out to their their training program as well. So I got trained in how to be a Gallup trainer. So yeah, exciting. But man, things have changed so much, right?
Yeah.
So, but I still hire. We hire a lot, right? We've through the entire pandemic at Spineology, we a lot of times, look, we've been with the big companies before, and you go into challenging and stressful times, right? And headcount freezes and travel freezes, but yeah, we haven't stopped any of that. We've continued to hire through today, right, through this pandemic. So it's needed. So
so what, I'm just thinking of maybe there's a person out there that has interviewed with maybe a Stryker, a Medtronic, a Globus, one of these leading spine companies, and maybe they're not aware of Spineology. So for that person out there that sort of meets all these requirements and is for lack of a better term, a stud, what would you say to that person that's kind of considering a larger company and maybe doesn't know about Spineology?
Yeah, it's there's good and bad about every company, right? And I've been fortunate enough to be able to work with many different divisions and business units. But Spineology, again, I think you categorize us as providing this platform of really innovative technologies, right, and solutions. So, for me personally, right, coming out now, I would want that, right? I would desire to have a platform, right, where I could offer, again, different solutions to help surgeons build practices, right? And really provide some solutions. And I think that's unique to Spineology. We're able to do that, right? So the others are critically important, right? We get that. So, things seem to be moving, as we said earlier, less invasive based procedures, imaging, navigation, robotics, and things like that. But we're partnering with different groups and companies, right? But we feel our technologies today provide, great solutions for surgeons. So, I absolutely would, consider us, but it's a grind, right? Because I think over here, as you know, right, we do a lot of stuff, right? Wear a lot of hats. As I said, I traveled a lot last year. I still enjoy customer facing, right? I love coming out, love having dinners, love going into surgery still today. So it's a fun place, but I'd definitely consider us for sure.
Yeah. Where are maybe some parts of the country that you're underrepresented, or maybe a better way of saying is don't have representation that you're looking to bring people on?
Trying to flood my LinkedIn box right now, aren't you? So, look, if you're not in it, again, I would go like a medical device sales pro, like what you're doing. And if you've had that, and whether you're looking to break in after that training or you're in a current role looking, for us right now, I'm still that old school where we can grab talent. We hire talent.
Yeah.
And John Booth is the same, right? We think much alike in that regard. So, but some gaps right now, look, all over, right, the country, but certainly the Midwest, Central region right now. We're recruiting into the Northeast quite a bit right now too, up into, New York, Boston, Pennsylvania.
What's the gentleman's name in the Northeast? You're the VP of Sales of the East.
Yeah, Jim Duffy.
Yeah, great guy.
Yeah,
I met him at the New York lab a few months
Jim's
back.
a good dude.
Yeah.
Jim, we've got a great group up there. So Kevin Monk down in the Southeast, you met Kevin. Kevin runs a great group. They're extremely talented, so that's a great piece of our business. Todd Stoller, Todd. Todd runs the West for us too. Does a tremendous job too. We look over here. It's funny. We've got a great, out in the field right now. We're just about 50 overall as far as representation out in the field. So it's fun, and we create development pathways. We're hiring, right? So actually, one of your local reps is, I think, promotion today, right?
Yeah.
That's going to come across the wires. I'm very excited for him too. But that's cool. So you can come here and think of not just a job, but a job with upside, right, and potential, right, and development pathways. So that's what we're creating here too. So
I think for anyone, in med device looking at a company, I go back to it, technology and people. Do they have a differentiating technology? Obviously, OptiLift, Mesh, and the other platforms that you have and solutions. And then the people, going back to John Booth, yourself, your Todd Stollers, all these people have been in the medical device industry for quite some time. So they have the experience, but they're just good people. And that's, at the end of the day, you want to be around people that you enjoy being around. Right. And I think Spineology has that. And so it's an exciting time for me and for our team, and really enjoy working with you all. So we'll wrap this up. I guess a couple of final questions. Any book recommendations? I'm a big, when I talk to somebody for the first time interviewing, that's one of my big things. What's the last book you read?
Atomic Habits is a great book, highly recommended. Any of the reads from Jocko. I mean, there's just so many, books out there today, and podcasts as well. I'm a Tim Ferriss fan. Listen to quite a number of his podcasts. So, but Frank, I learned from my team. I do. We've got a rich history, as you said, with John and Dan and many others in the team, and Wendy, you've interacted with as well. But I learned from the team, and I'm learning from new people that we're bringing in from different areas, different businesses, and I probably learned the most from that.
Yeah.
So,
what advice do you have? For me, so I was a sales rep at Stryker, sales rep at Invasive, and I said, hey, I'm going to start a distributorship, and I'm going to hire people. So at Stryker and Invasive, I was trained. Excuse me, I was trained for being a sales rep, but I never got formal leadership or sales manager training.
Right.
What advice do you have for somebody like myself, or maybe somebody new in leading people?
Yeah, that's I look back and say, and my teams know this too, the two most important things to me, right, is being a dad, number one, and then number two is leading people. That's a big responsibility, and there's no playbook to do it, right? And people try that, right? But I think of it also as, there's a probably more of a military thing than anything that I've learned from is there's a difference between friendship and leadership, right? So, and that's part of, even in the military, right? It's officer quarters and enlisted, and when it's go time, like I said, we're coming into surgeries, right? So you get that one opportunity when they're, choosing your solution, right, to provide that for a patient. So you've got to be ready to go. So to be able to train, teach, coach in that environment, you have to be able to articulate, form a vision, right, cast that vision too, and get people to really kind of align and line up. So there's a lot of resources out there, that certainly help, but but again, I think it's still, to your point earlier, it's people, surrounding yourself with great talent, right, getting yourself into some kind of, I'll call it fringe roles, pushing people in the pool a little early. Works well too. See if they can swim, right? We talked earlier, it's like I'm a military Navy guy, right? So everybody in my family, we passed through and had to. You don't teach a Navy SEAL, right, or a Navy pilot, right? Or you do teach them, right? But they're not born a Navy SEAL, they're not born a pilot, right? So much like here too, it's you come in and you're in a very unique environment when you're invited in to support, a surgery. So, from there, it's really lining up with your people, and then, being able to, I think really, people hear me say, you have to be able to cast a vision, right, and then formulate a strategy around that vision. We're always measuring and monitoring people. You are too, right? And celebrate your wins. Be able to talk about some of the losses too, right? But in the end, we're not making sandwiches here, Mike, right? So,
no, I mean, it's a funny saying, but it's so true. We're here to take care of somebody's mom, dad. The surgeons are here. The surgeons are the one doing it, obviously, and their team, and we're part of that team. So that's the goal, is to that person on the operating room table, get rid of their pain, provide them a better life. And, I think the good medical device reps and just the good people in general understand that. Right. There's a person on there. There's a mom, there's a dad, there's a brother, there's a sister. And, it's a job just like anything else. And there's days where you're like, I just want to go home. I have this event, blah, blah, blah. But I think you got to take a step back and realize, is that the attitude I want to have if that was my mom or dad on the table? Like, just punching a clock.
Such a great reminder. I think back of, sitting when, we had a distributorship for a number of years as a business. And I can still remember sitting out in the driveway with my wife, taking an inbound in the pouring rain, right, from a courier, right? And we're counting screws and putting stuff back together at 3:30 in the morning. I've had surgeons call me, in trauma call, right? And I'm coming over to pick you up, right? Before, of course, married and kids. And then once you're married with kids, same thing happens. But you're so right, though, because it's somebody's loved one on the table. And if you have that mindset, and you're not the surgeon, right? You're not the nurse. You're not the, you're part of that team. You're invited to be part of that team. And if you think of it from that perspective, right? Somebody's loved one is there. That kind of changes that motivation a little bit for you. When I was in the OR quite a bit and still managing directly into the operating room, and I had teams that were doing that, I'd ask some of the new ones that were coming in, or I'd instruct them, right, when we're waiting, because those are, hours and things are delayed, to go out of the doors, right, and then walk by the, patient waiting area and walk by there, because that's where their loved ones are, right? So they're there for hours, right? They're nervous, they're scared. So it's good for the perspective for the sales rep to be able to, again, go there and see those people, because then you're like, that's what they're worried about. So that's an extra motivation when you're, I've Pat Larkin, guy out of North Carolina, great, one of our leaders here at Spineology, told me a story. He's running 4 hours one night, right, to pick a product up from another rep as a handoff, right? 4 hours one way, 4 hours back. So we talk about things that happen behind the curtain, right? Nothing's perfect, but boy, what the men and women do every day, right, to support not only Spineology products, but all the products and companies that you represent too. It's a heck of a job, yeah. Right? It's rewarding, right? But it's certainly not for everybody.
Yeah, actually, you reminded me. I had a dream last night. Show up to surgery, patients on the table, and I'm looking at the back table, the mail. None of my stuff's there,
right?
And it's one of those dreams where you show up and none of your stuff's there, and everything falls apart, And I have that dream, I don't know, maybe a handful of times a year. But it's funny how you mentioned driving 4 hours one way, 4 hours back. I've been in that boat before, and it's a lot of the stuff that goes on behind the scenes is pretty wild and crazy that some of the reps, what we have to do to.
It's so funny. It was before Christmas. What's become a very, very dear friend of mine, neurosurgeon, moved back into to the state of Wisconsin, and he gave me the break in med device. And I worked for a small little company, and you're grinding, trying to get that first opportunity, right, to bring your products in. And I was able to showcase some pedicle screws one time, right? So did that, never got the chance. And I think at one point, I think I ended up with the cervical spacers, right? So I got those, and it was like an hour and a half drive up to do that. And I'm all excited, and I get that case, and he was actually starting a spine practice up at this new hospital, right? Kind of a rural country hospital, and one of the reps had forgot product, right? And I'm up there, but I knew I had product about an hour away, right? And he had nothing. And I see the surgeon, this is real life, right? Yeah. And for those that don't know, sometimes this is kind of life of the medical device sales rep, and certainly today. So I looked at him, and I saw this kind of look in his face, like, a panic, right? So I looked and said, how can I help? And he looked at me, and he said, can you go? And I said, I'm gone. Let me get it. So I jump in my car, and I knew a contact in another hospital, right? So I get in my car, and I'm driving down the highway, 100 plus miles an hour, as fast as my car could go at the time, right? Foot in the radiator. And I get there, and I made the communication there, so they get the stuff that I needed. As I pull up to grab it, along came a police car, right? And the lights are on. So I'm like, pinch me for speeding. But they communicated to him to the hospital, so they picked it up and said thanks, and he grabbed the stuff and raced it all the way back up. And right? So they get up there, get the stuff up there, right? And then from that point forward, right, I gained his trust, right? So that trust went up, the guard went down, and really built. That was really my kind of leapfrog into my success in med device, and then just being prepared, right? Having a backup plan.
Yeah.
With anything, got to have a backup, as Jocko says, right? Got to have a backup, and he just moved back, so that was 20 years ago. Called me a couple days before Christmas. He's back in my home state and said, "Hey, let's get together." So him and his wife came up and saw the kids and watched our family kind of grow up. But just funny how
that's wild
how this all works, right? I mean,
yeah, going back to trust.
I was going to say, how'd you break in?
So, Pfizer to Stryker, and I remember. So my friend went from Pfizer, and he went Jeremy VC, great guy. He went from Pfizer to Stryker, and he was a trauma rep in Las Vegas, which was pretty wild. And I'll never forget it. He's like, "Yeah, come watch the surgery." And it's a hip fracture. And, I walk in, first time ever in the OR, and, Vegas is a little bit of a different animal sometimes. Right. And, I walk in, and they're scrubbing the patient, prepping for surgery, and the surgeon's, actually scrubbing it too. And he throws me the scrub brush, and baseball, like I'm just automatic, like,
right.
And so he's like, "All right, you got to help out." He threw me the scrub brush. I was like, "Oh my God, this is crazy." And that's right then I was hooked. Right. I'm like, I want in. And so there wasn't a spot in Vegas. And so Kevin Brothen was down here in Arizona, and he gave me my first opportunity, and so I owe a lot to him. And we had an amazing team at Stryker down here in Arizona. A lot of the people have gone on to, leadership roles and distributors, and just have enjoyed a long career. But our team was a lot of fun, and that's one thing I think I've carried along with me is just that team approach. I think just with anything, just kind of having your tribe, your people that you trust. And
you see it with your team, when I walk in your building. That's pretty cool.
Yeah.
Pretty special. And not everybody can do that. Yeah. So it's
well, hey, thanks for joining me. I know you gotta go golf. I'm gonna turn off my timer here, but no, I really appreciate you coming in and spend some time. It's great to speak with somebody with your experience and your perspective, just having traveled around the world, and supporting surgeons, and just really look forward to the future. So you're going golfing today. You have a foursome. Who do you see coming out on top? Is it going to be a friendly, or are there some side bets? Or you don't have to name names who you're going golfing with, but
boy, look, I'm a competitive guy, right? So it just depends. But I'm from a young, this tall, right? I was a Larry Bird, Robert Parrish, Kevin McHale fan. So we'll see if I can take one of those guys down today. So all right, how about that? So
sounds good. Well, like I said, enjoyed your time. Have fun out on the
appreciate it.
Links.
Yeah.
All right.
I'll do my best. Hopefully I can limit my putts. But, hey, thanks for having me, and I really appreciate you and everything you guys are doing, and your support also with Spineology and our technology. Yeah. So,
absolutely. If you're not familiar with Spineology, I'd really highly encourage you, whether you're a surgeon, a patient, maybe a rep looking to get into the industry, I'd highly encourage you to reach out to Matt and really anybody at Spineology. It's a great company, great organization, great people, great technology, and so really appreciate your time today.
Thanks, Mike.